so welcome. My name's Liz Buckley, I'm the course coordinator for the Bachelor of Public Health. Thanks for coming today. I want to start our session by playing this Welcome to Country.
So I'd like to give a really warm welcome to Flinders University. This is Simona Laka-Tur, and she's our Pro Vice-Chancellor Indigenous.
And this is Professor Romy Lawson, Senior Deputy Vice-Chancellor. And we're located at Yungarenthi in Perilla. We'd like to acknowledge all the traditional owners and custodians on the lands of which our university is located within South Australia and Northern Territory.
And whether you're studying on one of those campuses or online, we warmly welcome you to Flinders University.
Yungarenthi in Perilla means meeting place in Ghana, and we were gifted the word Yungarenthi, which means to impart, to inform and communicate. We're right next to Yungarenthi Truku, the building where our Aboriginal students come and learn.
So to start your journey with Flinders, we're privileged to have Cliffy Wilson with us today. He's here from the Kumakaru and he's going to do a welcome to country for us.
Nyanka Namena, Namani, Nana Cliffy Tanku, Manacha Wilson, Nagana, Naranjiri, Naranga, Nadri, Alan Damayo. Mariwichanga Gana Meana, Nadlo Tambadi, Nadlo Gana Yatanga Tikandi. Na wanga di mani the bunigani yatana, na yukandalia yakandalia, na chalia. Good morning to each and every one of you behind the lens today. My name is Cliffy Wilson, but I also go by Tunkel and Manacha, which are both my traditional Ghana names down here in the city of Adelaide. So Tunkel is my totem, and my totem is the king brown snake, one of the most dangerous animals in the world. Also, Manacha is just my birth order name, which translates to the fourth born and male of my family. I'm a proud Ghana man from here in the city of Adelaide, but also a proud Ngarrindjeri man from back on the lower lakes of the Coorong and the Furua Peninsula. My family ties extend out to the Naranga people on the York Peninsula, also to the Ngadjuri people on the Flinders Ranges, and last but not least, the Aranda people in the Northern Territory of Alice Springs. I'm here this morning at Flinders University in Bedford Park, also known as Yungarenthi in Perilla, which translates to meeting place, which is located on the Ghana lands. And on behalf of the Ghana people, I would like to welcome those who are situated here in Flinders Uni at Bedford Park on Ghana lands, but also welcome those across South Australia who are located on other Aboriginal lands. May we pay respects to the traditional custodians of those regions and also pay respects to their cultural and spiritual beliefs, as it still is important to the living Aboriginal people today. Also, we do have campuses located in Northern Territory, so I'd like to pay respects to the traditional owners of those regions. And to the staff and students, may we take care of these campuses and the surrounding communities of these areas like the Aboriginal people have for many thousands of years. But also, may we pay respects to the cultural and spiritual beliefs of the Aboriginal peoples across the country and recognise that their connection to the land, the sky and the waterways that surround and connect us are still as strong, still as important, but also still as important to the living Aboriginal people today. I would like to finish off by saying Ngachalia and Nakara. Ngachalia means thank you in the Ghana language, and Ngachalia means we'll see you again when our paths meet. To all students, I would like to wish you all the best for the remainder of the year and for your future studies. Thank you very much.
Thank you so much, Cliffy, for offering us a welcome to country and also the acknowledgement of all the traditional owners on which our universities are located.
So welcome to all our new students. I hope you have an amazing first semester, and remember, have fun.
And I'd like to add my acknowledgement to country as well, and particularly acknowledge that Flinders University has a number of campuses across many different Aboriginal and Torres Strait Islander lands, and I'd like to pay my respects to their elders past, present and emerging. Right, so we're a small group today, but the live stream is being recorded, which is really important for students who can't attend today. So the information that we'll be going through is really about welcoming you to public health and your studies in public health, and making sure you've got the essential information that you need to start your studies. There'll be introductions to public health academics who you'll meet over the course of your studies here, and then at the end we're going to have a student panel session where some of our current students will provide some tips on surviving and thriving during your public health studies. First, I'd like to invite Professor Karen Lower to welcome you to studying in the College of Medicine and Public Health. Karen is our Dean of Education, and it's just a brief intro. Welcome, yes.
Very, very brief. Thanks, Liz. Hi, everyone. How exciting to be here. So my name is Karen. I'm the Dean of Education here for our college. I don't know how much you know about Flinders University or its structure. I thought I'd start. I promise a couple minutes. But the university is made up of 6 colleges. So there's education, psychology and social work, nursing, health sciences, etc., etc. So we're medicine and public health. So every college has a Dean of Education. And my role is really to basically make sure that what we're doing in education in the college is what we should be doing, which is giving you the best possible experience, supporting you, making sure that you're achieving your learning outcomes, whilst also, learning about the discipline area that you're moving into and what that looks like as potentially a future career. So public health, I think, is amazing. My background's genetics, so I'm a geneticist. So public health I came to understand a little bit late, and mainly from working with all of these amazing colleagues here. But in our college we have, medicine and paramedicine and medical science and areas like that. And it's becoming more and more clear to me that public health is really the thing that pulls all of that together. So the importance of, being able to respond to public health situations as the need arises, but also just as, or maybe even more importantly, that forward planning to make sure that all of those other systems like medicine, etc., are working to achieve the outcomes of it. So I'm so privileged to be able to have public health as part of the college. And as I said, it's just such an exciting and important area that I'm thrilled that we get to support and teach students in this area. So I am a geneticist, but the one thing I did want to say is that, and it's probably the thing that I bring most to this role, is that I'm what we call first in family. So no one in my family had been to uni before. I don't know if anyone else here has had the same sort of background. And when I started uni, it's a long time ago now, I actually dropped out the first year. So I went for the first couple of weeks and was like, I don't understand a word they're talking about. I don't know what a tutorial is. I couldn't find my labs because I was doing science. So I left and went and worked full-time at Hungry Jack's. And then after a year, I thought, actually, maybe I'll give it another go. And this is the university that I came to. And I managed to work it out. Because of the people, the staff, and the approach that Flinders had that just worked for me. I worked out what to do, how to study at uni, made friends, etc., found my people, and it was perfect. After that, I did my PhD, I've worked overseas, I've taught at Oxford University and worked there, etc. And then when I wanted to come back to Australia, I was like, I'm coming back to Flinders because this is the reason why I even had this career. So now I find myself as the Dean of Education, which is just like pinch me type thing. And it's, as I said, the most, I think, important part of what I do with my work is to make sure that every single student in our college, and we have nearly 3,000, but my job is that every single student feels like they belong, has a good experience, and wakes up every morning feeling excited about what they might experience today. So I have every confidence that this amazing teaching team is going to be able to do that, who I work extremely closely with. So the other thing, I guess, just to finish, is that I'm always available. I want every student to be able to have my number's 10 people that you can go to. If you've got a question, if you've got a problem, if you're not sure, and I want to be one of those 10, okay? So if you ever want to reach out to me, please do. You obviously got an amazing course coordinator and amazing teaching staff, but there should always be a huge, a significant number of people that will be there to help you if you need it, because I don't want anyone to sort of go through what I went through. I found my way, and I was pretty lucky to be able to do that, but things have definitely changed, and that student support is one of the most important parts of my job. So I'm going to hand back to Liz. Thank you for the time, and enjoy the rest of the session. I'm going to hang around for as long as I can, if that's okay. Thanks.
Thanks, Karen. I can vouch Karen is available to students and to staff. And what I perhaps should have done is put everyone's QR code up on the slide so that you can find them even more easily than Googling them on the staff website. We have another introduction as well. Of course, my slides aren't working now. We paused.
I didn't touch it.
No, it wasn't you, Karen. Okay.
Is a cursor on there? There it is.
Yeah. Okay. Okay. I have one more introduction for you. And this is a relatively new member of staff as well, and we're very excited to have him here. He is the head of the discipline of public health, and his name is Professor Richard Edwards. And it's been a long journey for him to get here, but he's finally arrived.
Thanks, Liz. Thanks very much, and welcome everyone. I'll acknowledge the traditional owners of the land, the Kaurna people, and their ancestors, past, present, and emerging. So I'm very, very new here, not just slightly new. I've been here a few weeks, and I've come over from New Zealand, and previously from the UK. I was in New Zealand for about 20 years. And I suppose the first thing I should say is, for those who are starting the course, you've made the right choice, both in terms of university and also in terms of the course. And I say that both for all the reasons for the university that Karen was talking about, for the course, for the wonderful teachers that you've got, and the wonderful course that you're going on, but also just the discipline of public health. And I just wanted to say a little bit about that. So I started, my journey into public health started as doing medicine in the UK. And I did clinical medicine, so I was working in hospitals for a few years. And then I decided to go into public health. And you might say, well, why would you do that? And I think there were several reasons, but probably the biggest one immediately was, and one of the great things about public health, I think, is the potential to make a really big difference. So my specialty was respiratory medicine, so I was seeing a lot of people with lung cancer and chronic bronchitis and emphysema and things like that, and they're almost all related to smoking, and that's become sort of my thing in public health, I suppose. There's lots and lots of other things, but that's become my main thing. And it's just because you just sent, and I was at a lung cancer conference last week, and you still get that same feeling. It's this desperately serious condition, and it's all preventable, or virtually all preventable, and relatively easy to prevent in the sense if people didn't start smoking. Of course, it's not that easy in practice, but so that's what got me into public health immediately, was the idea of making a really big difference. And I think in lots of different fields of public health, whatever you go forward with, there is that potential. So that's one thing. Another thing I think is just like any sort of university course, I think there's the intellectual discipline and the skills and knowledge that you learn. And I just happen to think that public health is a really interesting intellectual discipline, both in terms of some of the techniques and, whether it's epidemiology or qualitative methods, health promotion approaches. There's lots of theory and methods there, which I think is just really fascinating. So if you like that sort of thing, you're in the right place. I think there's a whole sort of intellectual inquiry, and the course will give you transferable skills in many different fields, whatever you go into, or whatever aspect of public health, if you continue in that line of sort of career. But the third thing is about public health that I really like is the values that it has. And public health, and this is not just public health, of course, but public health is, I think, characterised by really strong values of social justice and aiming to address health inequities, concern with communities. So that's, for me, that fits with the values I have. And what you find, I think, in public health is that those values are really strongly shared by people in public health. So if that's the way that you sort of look at the world, it's a great place to be. You have great colleagues who share your sort of worldview. So I think there's lots of really good reasons for coming into public health. So I think you've made the right choice. One other one that I think maybe illustrates it a little bit. So I'm getting on a bit, and some of my peers and that are thinking about retiring or are retiring and that, and a lot of them are they're fed up with what they're doing, and whether they're, I don't know, working in finance or teaching or all sorts of things, but a lot of people sort of get a bit burnt out and a bit exhausted by it. I've never felt that with public health. You know, it's always been a passion, and it's always something that you just think, oh yes, you know, maybe we can really make a difference on this or that issue. And it does have this broad aspect of what you can end up doing. So, say I'm in academic public health, so I do research and teaching, and it's a lot of it is about smoking and policy. But I've done lots of other things as well, even in my relatively narrow career within public health. So there's lots of possibilities. So I've investigated outbreaks. I've worked in sub-Saharan Africa on setting up health clinics and evaluating them. I've written a leaflet about how to treat scabies at one stage. I don't know how I quite got into that. But there's all sorts of things that I've done. So there's a lot of variety, and that, you know, keeps life interesting. So finally, I'd just say, for those of you who are starting in the course, just to in terms of advice and things, I'm sort of thinking back to when I started. And you've probably heard all this before, but I think probably some of the most important things are to really engage with the course, and you do get in what you get out what you put in. And so I just really encourage you to, if you find something of interest, you know, do that extra reading, go to some extra talks, ask lots of questions, engage with the people who are teaching you, because it actually makes teaching much easier if people are asking and challenge what you're being told as well, because that's all part of what a university environment's all about. It's about critical thinking, it's about discussing ideas and so on. So just really encourage you to do that, as well as Romy said, you know, have fun, engage in the wider student life. You know, that's part of what the whole thing is about, coming and being at university. So yes, so welcome to the course. I'm sure you're going to have a fabulous time. For those who are on the course, I'm sure you're going to continue to have a fabulous time, hopefully, and you're going to learn some really important skills which you will be able to apply to make a real difference to the world. Thank you.
Thanks so much, Richard. That was great to hear about your experiences and journey in public health. And I think what you say, well, often we get students who come and study public health because they also want to study medicine. But it's good to hear about how people who have studied medicine and who are clinicians also value and go on to study public health as well, because it is so important. Okay, so the next part of this session will be about making sure you have the essential information you need to start your studies here at Flinders and in public health. So probably first thing is to make sure you've got access to the Wi-Fi. So on all the campuses there is EduRoam, which is a free Wi-Fi. To access it you need your FAN, and you also need your Flinders password. And there's a link here on this slide if you're having trouble accessing the Wi-Fi. All of these slides will be available on the public health course flow site after today if you don't capture all the information straight away. The new student page has a lot of information about how to enrol and register in your classes. You'll have a study planner available to you, which is the public health study plan, and you'll see that you have a range of courses to take in the first year. So they're the ones that you would be looking at enrolling. We have Lani, our enrolment and course advisor, at the back here. So if you are having any problems enrolling in your courses or knowing which courses to enrol in, she can certainly help you do that. So it is important to enrol in your topics rather than just turn up to them. Log into the student system. There's a list of instructions there in the bullet points. You should be able to find how to enrol them quite easy if you follow those steps. Sometimes if the course or the topic is really large, you'll have to register for particular classes. So make sure you do that. This is important, particularly in your first year topics, because you do a number of those topics in the College of Nursing and Health Sciences, and some of those topics are very large, so you will need to register for particular classes and tutorials there. You'll need a student ID card. They're really useful, not just for student concessions, but you can use them if you join the gym as well. So it's your access to the gym. You can use them in the library, and I think you also use them for accessing the printing as well. So it's really important to make sure you have your ID card. And again, this information is available in the student website on Flinders. So if you haven't studied at university before, or actually, I think they do use learning management systems in high schools as well. The one we use at Flinders University is called Flow or Canvas. You'll hear both of those terms used, and you'll find you'll be able to access all of your topics that you've enrolled in electronically. You'll find all your topic content in there. Your assignments, you'll submit your assignments through Flow as well. So it is important that you make sure you have got access to Flow. There are a few orientation sessions around accessing Flow, and also an introduction to how to use it, which I'd recommend you do those if you haven't used a learning management system before, or you're finding Flow hard to sort of find your way around. There's a number of scholarships available to undergraduate students at Flinders. You don't have to be academically gifted to get a scholarship. So I'd really encourage you to have a look at the scholarships page to see if there are any scholarships that you might be eligible for. Even from a point of view as you know, having obtained a scholarship, it actually looks really good on your CV when you're going to apply for jobs later as well. There's a number of different ways to get to Flinders. It is obviously not as central as the city campus, but there's a lot of ways to easily get here, particularly by train and by bus as well. So if you're coming from out north, you can come in, catch a train from the railway station. It takes no time at all to get here. There's a range of buses to get here, about 40 minutes from the CBD. There's ample parking, but if you are going to park, you will need to apply for a parking permit. And there are loop buses to Tonsley campus, to the top of the hill on Bedford Park, down to Sturt campus as well. And that's something to keep in mind, particularly in first year, getting to the Sturt campus for your topics there. There's 24-hour security available on campus. There's a hotline and a phone number for that here. It's important, I would keep that in the back of my pocket. I would put it in my contacts, save it as a favourite, just in case you do need to access security for whatever reason. They actually have an office in the plaza next to the library. It's a little bit sort of back in the corner, but it is there, and you can go there at any time if you need to. They can walk you to your car if you're studying late on campus, and I would ring them up at any time to do that if I was at all worried about getting to my transport. They're very happy to make sure you get around campus very safely, which just leads us on to safety. So Bedford Park in particular, but all our campuses are quite large, and so you can see a range of behaviours. We do encourage very strongly to have respectful behaviour on campus, but occasionally you might see some behaviour that you don't think is acceptable. If you can, it'd be great if you could make a confidential report about unacceptable behaviour, whether you experience it or you see it yourself. And there's some ways to do a confidential report there, keeping in mind that a confidential report isn't actually making a complaint, but it can be the first step in doing that if you need to. And certainly there's no way that, Flinders University needs to understand if unacceptable behaviour is occurring in order to take steps to prevent it happening again. Student Learning Support Service, I think I encourage all students to use this and to access it as much as they need to. It's a great resource for general academic skills and help. You can get or access one-to-one study support either online or in person. You can take workshops that can help develop academic skills, particularly around literature searching. You can also do that through the library as well. There's a whole range of resources available there through the link. That's a link that I have bookmarked in my browser, and I'd encourage you to do the same as well. You can also physically go and visit them on level 2 of the Central Library as well. They have a learning lounge there, and you can talk to a learning advisor to get any assistance that you need with your studies. So we have a library at each main campus. Obviously there's one here at Bedford Park, there's one at Sturt as well, and our other campuses also. A lot of the textbooks and resources that you might need to access are available electronically, but there are also still some old school traditional hard copy books available. The librarians are amazing, and they can help you find all the literature that you need. And I'd encourage you to speak with the librarians when you need some help trying to find some literature. This is a new program at Flinders University called Better You, and it's really the gateway. It's bringing all of the wellbeing programs, supports and resources that Flinders University offers into one place. So these are programs, resources and support that are here to help your physical, emotional and social wellbeing. It includes the health, counselling and disability services, Oasis, and they're the only ones that I can remember at the moment. But if you go to this website, they have a list of all those different resources and services that are available. So it's the gateway, it's the portal. So health, counselling and disability services, you can see a doctor or a nurse on campus. All eligible services are bulk billed, so for most of your needs, they can be free to you. You can chat with a counsellor. If you need to think about applying for and getting a disability action plan, you can talk to the disability advisors there. They can help you put that together, and then you can use it in your studies as well to negotiate timelines and accommodations for your assignments. There's also a range of self-help resources there, fantastic service. There are after-hours crisis support helplines as well. I've certainly used this service from time to time as well, and they're amazing in there. Oasis is the Student Wellbeing Centre. It's located, it's over that way. It's up past the library. You go through the hub, up the stairs, through the doorway, past the coffee cart, and you'll find Oasis up there. And it's a really great place to go and meet people, to support your spiritual well-being, to find quiet places to study. The thing that I've heard students talk about the most with Oasis is the community market. So they have low cost and free produce available for students. You can go there, take your shopping bag, you can find free food and also low cost food, just the staples typically. They also have resources available for your spiritual well-being, but also just meeting people, connecting, supporting your social well-being as well. We have international student services for international students. These are your first port of call when you're coming to study from overseas at Flinders University. They provide a range of services, particularly as you're coming to study here, but they also support international students as they continue through their studies as well and they complete them. And again, contact information is there And if this is relevant to you, I'm sure you've probably already been in touch with them, but their contact information is there anyway. We have Young Corinthi. So this is the support services that we have for Aboriginal and Torres Strait Islander students. It's over that way on campus, and they help students, Aboriginal and Torres Strait Islander students, find their way around campus. They help them with social events, developing study skills, and a whole range of resources that just support them as they're studying through Flinders University. And again, contact information there. Our student success and wellbeing advisors are here.
Hi, thank you. Hi, how are you going today? Good? My name is Ana Diaz. Thank you. That's great. My name is Ana Diaz. I'm the Student Success Wellbeing Advisor, and we are a team of 3 people. So my other colleagues are called Melissa. So Melissa 1 and Melissa 2. And the person that is going to be collaborating with your college is Melissa Sackley. She cannot be here today, so I'm just representing her. So normally what we do, it's called Student Success Wellbeing Advisors, and you have realized there is a lot of acronyms here at uni. So they call us the SWAS. But I like you to think about us as like the glue. We're the glue that keep all the services you were talking before together. So what we mainly do is we can try to help you to keep your studies on track. So you start studying studies, transitioning again. It is like difficult sometimes, and maybe you need some assistance about that. Please send us an email. So you have the QR code there. In there, you're gonna find a webpage where you can just write to us to support network at Flinders, and Melissa probably will be the one answering back to you. Or you can also book an appointment with her. It could be online, in person, or by a phone call. Normally we can just meet you at Sturt campus or here at Bedford Park. We can also help you to triage you. So if maybe there's too much information you're having today, yes, you feel a bit overwhelmed, a little bit. Okay, so if you forgot about what is OASI for, where was the SLSS thing you were mentioning, just send out questions and we just try to link you or to glue you back to those services as well. And also if you're experiencing complex issues, well-being, life personal matters that are impacting on your studies, you need some further support and advocacy from your college as well, please reach out immediately. We won't tell anything you don't want us to tell, but we can help you out to show what is the best support places at the uni that we can help you with warm referrals and help you to get ahead of your studies. So welcome to Flinders, and sorry to interrupt just so suddenly. What's my name? You don't need to remember that. Melissa, okay?
Thank you. I can certainly vouch for how amazing the Student Success and Wellbeing Advisors are. I've worked closely with Mel Suckley for the past couple of years, and she's incredible. She really helps students get through and become successful at university. I think I would add that to the list of 10 contacts. Mel Suckley, Student Success and Wellbeing Advisor.
She trained me. She's the best.
She is amazing, yeah. Okay, so you may not be thinking about it just yet, but you might start thinking about this soon and becoming career ready. So Flinders University has a team that provide you some resources, some information, help you develop the skills to become career ready. So I won't say you have to start thinking about this now, but when you do start thinking about it, keep these people in mind, because they've got a wealth of information about how to put together a CV, apply for jobs, and a range of different resources. Okay, make the most of orientation. It's a big week at Flinders, so there's a range of different events. You can plan your week through the orientation planner. If you log into Flow, you should be able to find the orientation topic. I was having a look at it this morning. I know what I would go to, and I know what I'd encourage you to go to. I would go to the Sturt. There's a hub event at the Sturt campus, because as a first year student, you will be spending some time at Sturt campus, so it's important to know your way around there. There is also the the flow training session, that's another good one. And there's the library session as well. There are a whole lot of meet and greet and social events as well. I'd be going to those ones too if you have time. So I encourage you to plan your orientation sessions. They're running all this week. Oh yeah, the buggy tours, I'd do that one because Flinders, Bedford Park, it's a very hilly campus and I'd be on the buggy tours. Okay, so that's orientation week. Next week we've got Connect week, and that's really about making connections at university. Coming from high school, I still remember my first day of university. It was a long time ago, yes, but I still remember the fear I had inside of me about whether or not I'd make any friends. Connect week is all about making those social connections. So you'll be able to find information about all the events that are going to be running next week, and really encourage you to go along to a number of those, as many as you can. There'll be quiz nights, market day, I suspect that's at Oasis, Sunset Cinema out in the hub, that'll be fantastic. It's important to know semester dates. So we've got O week this week, this is week 0, but teaching starts next week. So it's really important to be ready and prepared for that. The last day to enrol in topics, if you haven't already done so, is week 2, okay? Census date is probably one of the most important dates that I talk to students about. This is the date that you can, up until which you can withdraw from a topic without having to make a student financial contribution to it. So that's an important one to keep in mind. It's at the end of week 5. Also at the end of week 9, in the middle of May, is the last day to withdraw from a topic without failure. We don't typically have examinations in the public health topics, but certainly the dates there are available if relevant. Okay, top tips. Keep an eye out for the student newsletter ping. A lot of information that will be relevant to you. You do get a lot of emails, but some are really important to look at. Ping's a useful one. It's good to know what's happening around you. Follow the social media accounts for Flinders University. Think about joining the Student Association. And I think the most important one is don't be afraid to ask for help. It's been mentioned before. Karen mentioned it, Richard mentioned it. We're here to help you to have a successful time at Flinders. Right, so we're going to, next session will be talk about academics, but first I just want to invite Lani up to talk about the student administration team that we have in the college. Lani is an enrolment and course advisor. And she's going to let you know what the team does and why you might want to talk to them.
Yeah, hi everyone. So my name's Lani. I'm an enrolment and course advisor at the college. We've got a student administration services. So Liz has spoken everything more, topic specific, that type of thing. We're more the admin side, behind the scenes. So helping registering for classes, enrolments into topics. If you have questions about grades, we've got a whole team behind the scenes that just helps with the admin portion of it. Now, I know that there's been a lot of information, so the easiest way to get a hold of us is on your Okta dashboard to click on Ask Flinders and just submit a request. It will filter through to where it needs to go on our end, and then we'll be able to help you out depending on the question. So submit and ask Flinders. We're also at the hospital if you do need to drop in. If it is anything important, definitely come on in. But the best place to contact is Ask Flinders.
Thanks so much, Lani. Okay. Now, not all of our public health academics could be here today. Orientation week is a very busy week, not just for students, but also academics. So we do have a few in the room who will introduce themselves, but we also have a few videos from academics who couldn't quite make it today. First of all, I'm going to invite Annabelle Wilson up.
Thanks, Liz. Hi, everyone. Welcome to Flinders. It's great to see you here. So I'm Annabelle Wilson. I'm an academic in public health, and a little bit about me. So I started my career as a dietitian, and yes, I studied nutrition and dietetics here at Flinders, which seems like a long time ago now as well. I now am both an educator in the public health program as well as a researcher. So a bit about me personally. I've got 3 sons, aged 9, 8 and 1. I'm also an animal lover with 2 dogs and 1 cat. I love cooking, particularly pizza, eating out. So I love trying all the great food restaurants in Adelaide. Probably fits with the dietitian food vibe. I really enjoy being active, and I spend most of my time outside of work watching my 2 older sons play basketball and play matches and train. So what do I actually do? What's my areas? I have a lot of research experience as a researcher in Aboriginal health. So that came from my interest working as a dietitian with rural and remote communities in Australia when I was a lot younger. I then did a PhD looking at how non-Aboriginal health professionals actually work in Aboriginal health. So what makes it easier, what makes it harder, and how we can address some of those challenges. And I've spent a lot of my career actually doing more research about that, looking at ways to support practitioners working with communities. So I'm very happy to talk to anyone more about that. Since, or in the more recent future, I've kind of branched out more into the health equity, social justice field more generally. So, for example, at the moment, I'm doing a research study with some colleagues in Canada and the USA, where we're looking at the differences between the countries in how the dietetics profession is actually regulated in terms of social justice. So, for example, to what extent do the regulatory bodies or the people who kind of direct our practice and what we must do, to what extent do they care about social justice and health equity? How much is that written in the documents that guide our work? So that's really interesting. I'm also a qualitative researcher primarily, so I love doing interviews with people, hearing about their perspectives, recognising that there's more than one way to do something and understand something. And that ties into the last dot point, which is critical dietetics, which I've been involved in, which is really bringing a new approach into dietetics. It's asking critical questions. It's looking at issues related to food in the context of theory, health, equity, and asking how can we make this more accessible for everyone in a way that really supports people to be their best. So I look forward to working with you, and all the best for your first few weeks. Thanks, Liz.
Thanks, Annabelle. And now I'd like to invite Dr. Amy Hickman to come and introduce herself.
Thanks, Liz. Right, so my name is Dr. Amy Hickman. Let's see. I teach into the undergraduate program in 3rd year when you will be undertaking placements. So it'll be a little while before you actually get to meet me. But my other job is to do that at the postgraduate level as well. And I also teach health promotion. My other job is I'm a course coordinator for the public postgraduate public health programs as well. So a lot to keep me busy. And one of the things I like to do is to visit family once a year. You can tell that I'm not from here originally. I've been in Australia for about 12 years. and currently live with my family in Brisbane, but I also work here. So I split my time between the two. So in January, this January, just not too long ago, I celebrated my mom's 95th birthday. And I added that picture in there because as time goes on, I understand how much who we are is impacted by the people around us, particularly our families and our friends. As we step out into new ways of in our journey, like as you are when you're beginning your undergraduate career, that support is there for you, and it surrounds you, and you'll be finding new friends as well going forward. So 95, that's a huge deal, and I was very happy to be there with her. Another really big important influence on my life was the woman right here is Margarita. That's her research name. So I originally was a nurse for a number of years, and then I stepped out of the hospital for a little bit, had a family, and then went to graduate school to really think about the intersection of everyday ways of knowing about health and disease and the body, and how it intersects and bumps up against medical expertise. That really came out of my experience as a nurse. So I did that. That's really my research was situated in the humanities, but my dissertation, my thesis was situated in public health. And I followed Margarita, who is a health promoter, a promotora in Arizona, and she taught me everything I know about health promotion. Of course, nursing helped too as well, but basically her work in decolonizing medicine for community was really incredible. So I learned a lot from her. And finally, here's my family, my Australian family here. Well, we're all American, except for one, Sarah's fiancé. So we are now really rooted, and well, like a tree, in Australia. So 2 beautiful daughters and a husband and family around me. So last thing I want to say is one of the passions that I carry into most of all of my work is work-integrated learning. So this is really important for you now as you begin, because you bring a lot of experience with you. Some of you may have jobs. Some of you may have aspirations for different kinds of work that you want to be doing. Think about that now. What does that look like for you? How can you bring that into your studies? How can you make those connections? So we at Flinders really take this very seriously and want that to be integrated from day one all the way through the end of your university career as you make that transition out. And as a placements person who gets to walk and take that journey with students, it's great to see that transformation from being a student to being a professional, and seeing the growth that happens through that. So yes, that's what I want to say. Thanks for having me.
Okay, so Billy couldn't make it here today. He had another commitment, but I really did want to share his slide because he's one of the public health academics that you do come across in first year. So Billy's a health economist. He does a lot of, I would call it translation of research into policy and practice, as well as doing economic evaluations. And health economics is informed by the principles of public health, particularly around social justice. So he teaches the introduction to public health topic, and he really starts students thinking critically about problems, health problems that have an impact on populations and population groups. Josh, he can't make it here today, unfortunately, but he has left us with a video, which is on the next slide, but he is the inaugural course coordinator for the Bachelor of Public Health Honours Program. So you will hear from him periodically through your public health studies, and as he sort of encourages you and gives you information about the opportunities that you might consider, particularly around honours. So he's a researcher with a really strong background in tobacco control and prevention, but I'll let him do the talking. If I can just make it work.
Cool. Hi everybody, my name is Dr. Joshua Trick. I'm a behavioural scientist working here in public health, and I split my time between lecturing and research. I'm here to talk to you today as somebody who looks after students at the tail end of the Bachelor of Public Health in the Public Health Honours Program, which is something you might consider if you would like to go into a career where you have some kind of research activity that you're going to be doing, or work in non-profits and government groups that have a lot of that sort of activity as well. As you saw in my previous slide, I'm a behavioural scientist. I study largely addiction, risk-taking behaviours and risk attitudes. And at the moment, most of my research centres on tobacco control, addiction, vaping and those kinds of things. So you can actually study a large variety of different areas within public health. And I'm sort of an illustration of that, coming across sort of sideways from psychology. And over the course of the BPH, you'll encounter all sorts of different researchers, lecturers who have got different professional backgrounds. So you might be able to explore potential other avenues for your career later on. I'm located on level 2 with the other teaching staff. Feel free to come and talk to me or flick me an email if you're interested in this further or have some questions. Thank you.
Thank you, Josh. And again, Cheryl is unable to be here today, but again has left us a really welcoming
Hi
video.
everyone, and welcome to Public Health. My name is Cheryl Shellback, and you can see a photo there of me with my 2 kids. So I teach topics in both the undergrad as well as the postgrad programs, ranging from summer through to semester 1 and semester 2. You may be feeling a little bit overwhelmed with the amount of information that you've been given already, and I suspect you're not going to remember a lot of the information about individual people. So rather than tell you too much more about myself, I really wanted to just share this story with you about this cake. So this was not my cake, but it was one that I had made for a family friend. Obviously, we're looking at a significant birthday here. And the reason I'm sharing this was because it was actually not what it was supposed to be. The original cake, the one that had been requested, I'd made it and then I dropped it, so I completely destroyed it. So this happened, so significant birthday, as I mentioned, function centre booked, oodles of people invited, late at night, so I couldn't go out and buy new ingredients. So, you know, what I had to then do was to really just sort of stop and think and turn and pivot and think about what I could do with the time and the ingredients that I did have at my disposal. So during your studies, you're going to learn a lot of different stuff, and some of this stuff is content and some of it is more skills-based. So something that I'm really interested in is the skills that you're going to develop, because many of these skills will be things that you can rely upon and use in authentic as well as workplace contexts. So if we look back at my cake disaster example, I could have thrown my hands up in the air and given up, but I didn't. As I said before, I stopped and thought about what I could do with what was at my disposal and came up with a plan. And over the course of your studies, you are going to more than likely face situations that are a barrier, that get in your way, that stop you in your tracks. And this is unfortunate and it's unpleasant, but it is more than likely reality. What's important though is you work out what are your resources, what are those things that are within your control, rather than just focusing on what's outside of your control, and what you can do to get yourself across the line. Good luck with the year ahead, and really the parting words that I would leave you with is to reiterate what you would have heard from some of the other speakers around making it a priority to understand the resources that you have around you should you actually need them.
Thank you, Cheryl, sharing an important life lesson that we've all had. And here's Murty Matinti, who's a biostatistician.
I think if I
yes,
move
next
the slide,
one.
it'll
Hi everyone, and
it'll
welcome
have,
to Public Health. My name is Cheryl Shellback, and you can see a photo there of me with my two.
If you're okay talking to that one.
Yes,
Yeah.
that's all right. Hi everyone, welcome to Flinders. Myself Murthy Mithinti. I'm the discipline lead for biostatistics here. I'm not teaching into the undergraduate program, but Shahid will be teaching into undergraduate program, and you'll be taught introductory to biostatistics, which is a quantitative topic. You have heard a lot about qualitative topics, but yeah, biostatistics, I know most of you must be hating mathematics. That's fair enough, but like it doesn't leave you, unfortunately. Maths and quantitative part and quantification of information is very, very important when you make public health policies. So that will be a part of your learning biostatistics. Whether you like it or not, you have to take this topic, unfortunately, because it's a core topic. But I think the best part of biostatistics is bringing it all together, because you have lots of information. How do you make summaries of this information? How can you communicate this information to a wider audience? You all have seen during COVID that you were bombarded with information, you were bombarded with statistics. So that is all, a way in which you communicate information to public and also policymakers. So I teach two topics into masters, masters in public health, as well as masters in clinical epidemiology that we are starting. And you can see that many of the medical practitioners, registrars, practicing clinicians, they need to learn something about these quantitative skills. So they come back to learning epidemiology and biostatistics. So these are very, very core components of evidence-based medicine, and even which you are learning throughout your undergraduate and postgraduate public health. So that is we as a part of the discipline here at College of Medicine and Public Health within the School of Public Health.
Thanks, Matey.
Thank you.
Okay, me. Okay, so I am, as I said earlier, I'm the course coordinator for the Bachelor of Public Health, which means I play a role in making sure that the degree you study is an important one and it sets you up well for a career in public health or wherever you want it to take you. I teach epidemiology at the undergraduate level and also at the postgraduate level. So for the bachelor program, you'll see me in your second year. So I would describe myself as not in this particular order, but I would describe myself as an epidemiologist, as a researcher, as an educator, as a mother and a partner. I love public health because, well, certainly I didn't start out in public health. My undergraduate degree was in medical laboratory science, which I loved. I loved the scientific nature of it and thinking about these problems and using scientific method to answer questions that we had, but I really wanted to have a broader impact. And I managed to get involved somehow through a stroke of luck in health technology assessment. And this was really fantastic. It not only taught me critical thinking, particularly about research, it taught me, gave me a foundation in epidemiology, but it was also having an impact on policy and practice in the healthcare system in Australia, and that felt really important to me. So my research is in cancer epidemiology in particular, in health services and population health research, and I think my research is really important. Not everyone does, but I do. But what is even more important to me is that we teach people coming through Flinders University about public health. None of us are going to be here forever, so it's really important that we start sharing that public health knowledge and those skills for people who are coming through who can take that anywhere and everywhere. Public health is all around us. So teaching is not only really rewarding for me, but I think as a really important role for public health researchers to be a part of. The photos, well, it's my little fur babies here. We've got Alfie, Squeak, we've got Ghost. I do have 2 human children as well. They're much older, don't like me sharing their photos around. The 2 photos in the top corner, these are taken during my PhD. I was doing a PhD in breast cancer screening and epidemiology. And as a PhD student doing an epidemiology project, it was totally appropriate for me to attend a conference in London so that I could go and see the John Snow pub, who they're called John Snow, the father of epidemiology. And I went and saw the water pump. I'm not sure if Billy talks about John Snow in Intro to Public Health anymore, but if you come and study epidemiology, I promise I'll share the story with you. I think it's a fantastic example of how epidemiology can act quickly or relatively quickly and how it can save a lot of lives. So that was my pilgrimage during my PhD. While I was there, I also went to the British Library, saw the Book of Mortality Tables by John Graunt. That was amazing. I didn't expect to see that. So that's me. Right, this is the best part of the orientation session today. We've got 2 special guests here, Monica Hetherington and Laura Nunez, who are current Bachelor of Public Health students, and I'd like to invite them to come up to the front. You can sit down, you don't have to stand the whole time if you like. We've got some chairs here, it might be a bit more comfortable for you.
Thank you.
So I might just ask you two to both briefly introduce yourselves and maybe just say who you are.
Hi everyone, I don't know if that works.
It
works? Okay. Not very good at public speaking. So I'm Laura. I'm in the 3rd year of the Bachelor of Public Health. I'm originally from France, but I've been living in Australia for 10 years, I think. So quite a long time. I do the Bachelor of Public Health because I want to go into medicine later. I didn't choose it particularly because I love public health, but now I'm very, very happy with my choice for everything everyone I've said before. I think public health is a very important part of medicine, obviously, because, well, medicine treats patients that are already sick, obviously, but I think the prevention side is very important, and, well, it's interesting because it's never boring, it's always something new, because it's so much different discipline and field, and you will see on the study, I discover epidemiology, obviously, but biostatistics and stuff I didn't even know existed. And it's been very, very good. So, yeah, I love public health. And I didn't start it by loving it.
And Laura, do you study on campus or?
I'm only online, yes, that I should have said. Is why I chose public health, because this is one of the 4 bachelors who help you kind of go into medicine. But because I live far away, I live about an hour away of here, so I'm online only. So I cannot help about the campus, but if you have any question about online, I probably can help. Because I've done every mistake possible, I think, online. Because I'm not very good with computer, I'm a bit older, and I stopped school when I was 14 years old, and I've done many things before I came here. So I know quite a lot about the online system, which is changing kind of with Canva.
Yeah, thank you. Thanks, Laura.
Hi, my name's Monica. I'm also in 3rd year public health, but I'm in person here at Bedford Park. I also live on campus as well, which makes attending classes really easy, but also sus if I don't attend because I'm so close. I'm initially from Queensland, and opposite to Laura, I was actually on a medicine pathway initially, We had to do blood tests on people. I nearly fainted. Was like, maybe this actually isn't for me. So I did a bit of research, came across public health. It was only offered in Brisbane back home, and I couldn't think of anything worse about living in Brisbane. So I just applied to different universities, and Flinders really stood out. And it has only continued to impress me, to be honest. The support that I've had, like living on campus, like through topic coordinators, course coordinators as well, has been amazing, and I think has been vital in my success here, and also like keeping me here as well in a sense, because it can be quite daunting moving interstate to study.
That's
Does that
enough.
answer
That's
your
it
question?
for now.
Yeah.
Yes. My next question to you is, what excites you about studying public health? I know you touched on it a little bit, Laura, but I think you can expand.
Well, what I said before, and a lot of persons say, I'm interested in a lot of area, which is good and can be bad. But then I never understand how much different job and how many things public health does. And now I've done most of the topic. I found that very good, because you will find something that like a niche kind of topic that interests you, and in research, in statistic, working for government or non-profit, or like it's so many different areas. Whatever, if you are a person who is who love research, or who love to be education, even like a lot of things in education, or all of that. And I think this is very good, because we are in a world that evolves a lot, and so much happens, especially since COVID. I think that's a good example for public health, because so much happened around it, mental health crisis as well. Then you can see how many jobs is possible and how interesting is it. Also, I'm not sure, because obviously I'm just a student, but I think I like the idea of not doing always the same thing. And public health, you work into a project most of the time, so you can do something for a bit or a few years, whatever, and then change for something different and have different interests in your life. And I think that is a wonderful part about public health, I think. Yeah. So,
Monica?
I'd pretty much say like the exact same thing, just not being bored. And I don't like the idea of being stuck in one particular career, like my whole life. So I'm excited to try all different jobs, and also the opportunity to grow, whether that's like through academics, or like in promotion, or anything like that. So.
Great, thank you. When studying here at Flinders, whether online or on campus, what do you think are the best resources you've used for studying, for completing assignments?
For completing assignment, I will said, for studying in general, going through the website, understanding everything, obviously will be good, because last minute is a bit hard, trust me. If you have any question, ask them. I think because my English is not amazing, and I'm online, sometimes it's a bit hard to cut someone, a lecturer, or email someone to ask what you think is a stupid question. But now I don't do that anymore. And it can, look everything before. So if you have question, you can ask them to the person, like the lecturer, or email someone, or or the topic rep, someone. So you can have your answer, and don't put yourself in a bad position, because, I would say that's probably my biggest tip, is ask question. And read before. And the first years, I start with zero organization. And I work harder, not smarter. So I will also read everything to be prepared for question, and try different things, not taking where you study, at a cafe, at home, go in class, or do it online, whatever you're doing. Try different, because you will build a system that work for you, and you will be different than anyone else. And for assignments, I will definitely don't do everything at the last minute. Like I think everyone does that in one month, and I did that a lot because I didn't know anything about study, and I will work so hard and so much, and it's kind of shooting yourself in the foot because you will have to work so hard. Sometimes at night I have many kids and a lot of things going on, so it doesn't really work. So yeah, we'll definitely be more organized and and I always expect to find a system who work for me very quickly. No, it was a lot of error, and I tried different things, and I was surprised in, like, now the way I study is not the way I was thinking I will. So get organized by trying different system. I think is more important, and then you will get to the point where you work smarter and no harder, definitely. And sometimes you can be surprised in assignments. Something will seem to you simple will be harder, and other way around. So I will probably, read everything, the instruction, and ask the lecturer, because sometimes they don't know if it's if something is not clear or if a topic is new or whatever. About assignments, that's it. If you have any problem and disability or problem at home or something, I experienced a lot of that last year, and every lecturer has been very good with me. So I wish I did that the first years, but I didn't, because I was thinking, oh, that's not important enough or whatever. So I will definitely reach before you get to the point, or it's too late. Like, go to the lecturer, ask what you can do. If you need more time or if you didn't understand something, I will definitely ask more questions, and but I think that's it. Yeah. Thank you.
Monica, do you use any other resources apart from topic coordinators when you're doing your studies?
Would highly recommend asking questions through topic coordinators. But the two other things I'd suggest would be, firstly, Studiosity, incredible online resource. That's where you can draft your assignments. So you can send that through, and then someone will read your work, and they won't necessarily mark your work and like correct spelling and stuff like that. It's more so just helpful suggestions, like just to make the document flow better and like sound more professional. So I'd recommend that. And they get back to you in the wee hours of the morning at 3 a.m. So it's a great resource to have. And then also just the study spaces on campus, would really recommend those, because you can book study rooms to privately, get assignments done, so you're not stuck at home doing them.
Do you do that through the library? Do you book a study
books? I think it's online on.
All I do is search up book study room Flinders online. It comes up. So.
On Google, it comes straight. It's very simple.
Yeah.
Very simple.
Yeah. Excellent. So, would you, if I asked you the question, where do you go when you need to ask for help with something, would you add anything to what you've just said, or?
No, I will add for assignments. Something I also do only very recently is when you get I used to just look at the grade and don't care about literally would not read the feedback the first years, I'm not lying. But now I'm reading it, and I also ask questions. Like, sometimes I don't understand why that, or what I did wrong clearly, and I will ask questions. And I've seen quite few patterns that mistake I made often, even in completely different topic. So I think by analyzing the feedback and thinking about what was the mistake, even sometimes I will redo no one will see it, but I will redo the assignment with the feedback. I've learned a lot. Like that, I've improved my grade by massively. So feedback is important, I think, in general, in a lot of areas, but in assignment as well.
I know topic coordinators do try and provide helpful feedback so that you can action it for the next time. So it's a learning process. So feedback is important to look through.
Yeah.
Monica?
I think just help-wise, I've only ever really gone to topic coordinators or course coordinators, just direct via email, quickest way to contact people at uni.
Yeah, excellent. Okay, well, you spoke a little bit about organisation, Laura, but how do you use your time best when you're juggling studies and life?
Well,
it's the question we're all trying to answer.
Yes, I'll still try to answer this one, but yes, mainly what I said for me, because I have different work and kids and live far away and all of that. I had to learn to start with. I think that's important. So learning strategy to learn, to not taking, to all of that was a bit time consuming at first, but on the long term helped me a lot. So I will learn to learn. It sounds a bit stupid, but I will do that first to be the most organized possible. I used to plan like, I have to do this assignment or this by this date. I will plan a bit more time because it's, depending your life, but it's often a lot of unforeseen events. If you have responsibility or not, you can be sick or have a different type of problem. So I will plan in advance and have a kind of a plan B. Well, if you have my life, CG even, because like it's always million things happening, and I also underestimate a lot my time for study, for reading everything I have to do by the time. So I will end up to come at the class and half reading what I was supposed to do before, all of that. So I will take more time and try different way of not taking, studying, learning to memorize all of that. And I will insist on healthcare. So because self-care, sorry. Yes. Because I never look after myself, and I work a lot, I drink a lot, I smoke, I did everything you cannot do generally. And I was thinking, you will be fine, fake it until you make it, is my sentence, literally. But no, it doesn't really work on the long term, especially when you study, because I always did a ton of different jobs who were more like hardworking, so I didn't really need my brain that much, is where I realized that you need to sleep enough. No one can live on 3 hours sleep. It's not really good. You need to eat good as well, and to an extent exercise, have a social life, hobby, whatever. Because it's working for a bit until it's not working anymore. And I think when you go too much down, it's just too hard to go back up. So I will, don't be stupid, prevent it. Like, just look after yourself, do the right thing. It seems boring, but trust me, it can be quite hard when you don't do all of that. So self-care is important, and be realistic. And I think you never really stop learning or organizing yourself and all of that. But I think the most you are realistic and trying to add extra time where you think you have time, add extra time. So if anything come up, especially if you have kids or stuff like that, where it's just always something, I will just prepare myself for more. That's what I need, probably.
Yeah, great. Monica?
This is how I balance.
No, this is, how do you best juggle your studies and life? And you can talk about how do you look after yourself too.
Yeah. I don't. No, I'm kidding. It's hard in uni. I currently work Monday to Friday as well, so that's like a whole challenge in itself, trying to balance that with classes and now placement this year as well. I think most importantly, to stay on top of your studies, the best thing I can do for myself at the start of every semester is go on Canvas, look at all your topics, find all the due dates for everything, and I need to see them all written out, like with the date and time on just an A4 piece of paper so I can stick up on my wall and see it. Because if I don't see those dates, things don't happen, and I miss quizzes and all those little important things. I think I even missed one of Liz's quizzes one time. Oops. And that was purely because I didn't print out that sheet. I think that's really important. And then, as Laura was saying, obviously look after yourself and know that there's resources on campus to access to do that, such as Oasis. Great place to, have access to free food and like looking after your spiritual well-being, which is really important when life gets really busy and you don't have time.
Yeah. Some really good advice, and can I just add to it if I can? I'm still trying to work those things out. So, and it's not to say that it's forever. We're trying to manage all of those things. So, where have you found the best place to do your uni work or study?
Weirdly, I was because I never studied before. I have no clue, and I was thinking, home will be great, but no, because highly ADHD, so I want to do a million things at the same time. So being home, I want to do this dishwasher and do that and I get distracted, I got my phone. So it was not a good thing. But I start to go to cafe. So weirdly, because I'm in a cafe and I cannot do anything else in my home, I will be better. Library as well. I will come sometimes to Flinders when I have a lot to do, so I know I will not be distracted. After, obviously, the place, it's important, but also I think a bit of discipline and keeping the phone away, because it's very easy to multitask, and, well, no one can really multitask. So I will be careful of the environment, wherever is it, home or to a cafe, a library, at school. I will be careful of the environment, and you better to work with no distraction for a shorter time, and then allow yourself more, do whatever you want after that. So, and I will try, because I didn't think, but I love library and cafe where I really didn't think I will like it. So I will try different place probably, because I hate noise and I love working in a cafe. So it doesn't make sense. But I guess you need to try it out, I guess.
Yeah. What about you, Monica?
I tend to study on campus, and my favourite spot is near the FUSA office. So when you go to the orientation, like market stalls, downstairs in the hub, just the next level up, I think, it's a great area to study because it's got the private study rooms that you can book, but then also just more of a communal area. And they've got the ergonomic seating and great lighting and just nice views out the window. So yeah,
It's my favourite spot. Have you taken up any other opportunities at uni? You might have joined a club, gone to some organised events, joined the gym. How do you meet people at uni?
Talk about that, because I don't think I did much, because
I know
I
you've
tried
taken
to
up some opportunities.
I
It's
tried
a bit more students
to force myself to go into some kind of like today, but I did a few things. A few events with last year's the Wellbeing Center. Everything is online. I tried to book some of them through the Flinders Horizon Award, because it's some very interesting events, and every time I come to an event I'm like, oh yeah, I should do that all the time, and it's so good. But I kind of need to force myself and book, because you will meet so much people, and it's nice to get into this school environment. It's very good. But other than that, because I'm so far away, I don't know much.
But, so you're studying online, because I know you did make some good friends who were also studying online.
Yeah.
How did that work? How did you
How did I think mostly it was through class, when we will do work in our group thing, and after. Being I've been a student rep, and I think is where I probably talk to most people, because I will talk with students who come ask me questions, or will tell me a problem or a challenge with one topic that I will have to relate to the topic coordinator. That was a very good experience to know more people, because obviously in the same field you will find like-minded people, or people who want to do the same thing. Like I found Denise, who was my friend. She wanted to go in medicine as well. She is actually since last week, so I'm very happy for her. But I also talk with guys all the time from Darwin. I used to live in Darwin for many years, so I love is online as well, obviously, but it's a lot of different people from complete different life, so it's very interesting. I would say reach to people from your class pretty much. I've seen Monica many times in biostatistics, because I used to come to class for that, because it was hard mathematics, so I had to come and force myself. It was very interesting, so talk to people. I think. Well, student doesn't. Me, I talk to anyone, so it's easy. But I guess force yourself to talk to people and ask a question, topic rep, people in your class, because I've learned from just Denise alone. I've learned so much, because she studied before many bachelors, so she helped me so much to understand a lot of things. And sometimes when I have a question or something doesn't work on Canva, she helped me, or Jean as well. Like many of my people I could contact in iTeam and say, oh, did that work for you? And work out before I have to email someone and wait a few days to get an answer. It can be very helpful. And also it's good to see that other students struggle, are same than you.
You still feel really connected, even studying online?
I do, yeah. But I have to say Flinders is very, very great for that. All the resources available are great. It's fantastic, but you kind of have to do the first step, obviously, to contact the service. Even if I've sometimes I've contacted many times the mental health support, and I didn't do much, but they will tell me what to do or where to go, or it's same for my ask Flinders. I contact them every 5 seconds. They probably hate me, but I ask question, and then I've done better with my topic. I choose different optional topic. Because you have a list of topics, but you can search yourself and find something you're interested on and ask them if it's possible. Sometimes they will have to ask and let you know, but it makes the course more interesting, and it's opportunity you don't know they even exist. So I will ask whatever is the topic. Flinders is very good at. But I don't know. I don't have experience with any other university in any free country I live, but it seems very, very good.
And Monica?
The main opportunity I think I've taken up is the role as student ambassador that you can apply for at Flinders, as a job. That's not my normal Monday to Friday job, so that's just a bit of a side hustle, but it's a great role to have on the side because you can pick and choose your shifts, and if you need extra money, it's a great way to earn that. And then connections wise, great to meet people because all of the people I've met through that are studying completely different degrees. And I think that's been really great, and they are recruiting at the moment. So if if you're interested, I'd recommend.
Just put something in the course site. Yes. Okay, next question. Okay, I think we're getting to the end of the questions, but best places on campus, best coffee, doesn't have to be on campus, best food.
Well, I love
student life.
But no, I think it would be you because I drink 27 coffee a day. I try every coffee, and it seems good to me.
I think
we have to manage sleep.
I think the coffee place on your way to Oasis. I don't know what it's called.
Oh,
it's a little shipping container. So
good,
upstairs from the hub, incredible. The pies are so good. Coffee's great. The TAV's really good, in the hub, and they hold quiz nights as well throughout the semester, so that's a great way to meet people outside of your degree and just to socialise, because if you can show up and not have a team, and they'll put you in a team and you'll be forced to socialise and meet people, so that's great.
I think that's about it. Yeah, that's great. I think they're great suggestions. Any other questions that you might have about student life or studying public health? No? All right, well, thank you again, Laura and Monica. It's been great having you here today. Really appreciate it. You've given us all some really useful tips about studying here at Flinders, so thank you very much. So that's the end of the orientation session today. It is a lot of information that we've shared, but please don't be worried at all about trying to remember it. All the slides will be uploaded onto the course website, and it is typically very easy to find information at Flinders. Everyone Googles and it comes up in Google. So I would ask you though, if you do have an opportunity to complete this survey, which I think is around the orientation session that you've just experienced, and you could go in the draw to win $250. So thanks very much. I'm really looking forward to seeing you all as you're studying public health at Flinders. And there's food. Hey. Food. Oh yes, sorry. Yes, there is plenty of food. So please take some time to eat something, and if you have time,